only last up to a certain degree if there's also growing inequality. Sure. So why is inequality, I mean, some of the impacts of inequality, and this comes from the child gauge produced by the Children's Institute at UCT, and I see Catherine Hall's in the audience, okay, who did a lot of the analysis of the data. And this shows you how inequality impacts on people. You know, if you, in the richest 20% of households, no one goes hungry. And as you look down, you'll see that in the poorest, you know, the difference between access to water, I'm talking now, sorry, about children in the country. Inadequate sanitation, overcrowding, having inaccessible health facilities because it's too far from home. It's always worse for poor people who already have the biggest burden of disease. And I'll skip some of this. There's inequality, interprovincial inequality, which is shown here. David showed this data, which is the impact of various forms of inequality on infant mortality. Access health facilities from the poorest to the richest people. This shows the number of children who live too far from a health facility. And as you get richer, you know, it becomes more accessible. David spoke about the inequitable system division of health resources between private and public. And here you can see it again. So I won't go into this in detail, but what I would like to speak about is the fact that we live in an unequal society. And the question we're discussing is whether a decent health system can produce more social solidarity and more equity. Robbie believes it, I believe it. But we have to fix the health system. One of the things we have to fix in the health system is the inequality within it. What this slide shows is the difference in pay, salary scales in the public sector from the top management down to the lowest level of workers. There's 16 scales. And the richest, the people at the top, earn 27 times more than the people at the bottom. This is one of the biggest inequalities in the world. And this makes for sickness in the health system. You know, we all know about high levels of absenteeism, about nurses behaving badly towards patients. Why? They're living under tremendous conditions of stress. They themselves are not healthy. This thing has to be fixed as well. And then to go back to Rwanda, and we're looking at Rwanda now because it's recently become an example of what can happen with a national health insurance. Rwanda instituted a national health insurance recently. I forget exactly what year they did it in. And they adopted social policies following the genocide that focused on the health system. I'm talking about health policy.